Hello, hi, I'm Tess, and I'm just coming on this evening. Oops, sorry, a bit shaky. Just coming on this evening to talk to you a little bit about essential oils and how you can use them during your pregnancy and birth. You can use them at all points in your life, but this is the topic that we're going to look at today. So, I work as a health visitor, not in York, outside of York, and I just have a passion for essential oils. It's something relatively new to me. I sort of discovered them a couple of years ago. And I'm really loving them now, so I do some essential oil stuff outside of my work. So what I wanted to talk to you about was different essential oils that you can use during pregnancy to support yourself and to deal with some of the issues that come up during pregnancy, and how you can use them during birth, during labour as well, and also how you can use them in your pregnancy to help you in birth. So we can talk about that a little bit as well. So probably the most important thing really to talk about is to say that not all essential oils are equal, and this is a bit of a difficult issue really. So it's difficult getting hold of really good quality essential oils. So if you're using essential oils and you're going to be using them in massage on yourself at any point, but especially during pregnancy, you really want to be getting really good quality essential oils. So I do sell the essential oils. If anybody is interested, they are very welcome to get in touch with me. But on the whole, most of the essential oils that you can buy on the high street will not be really good quality. Unfortunately, you can legally advertise oils as being 100% pure, or say that they're organic, and the oils in themselves might be organic, but they can have other things in there, and you're not getting that pure oil that is what you really need at that point. So essential oils aren't going to be a cure-all. They are what we look at them as part of your sort of toolkit, and lots of things are really important to go along with that. So, first of all, things like good nutrition is absolutely essential, and looking after yourself and exercise and these things. So making sure you're taking your pregnancy vitamins and all that sort of thing. You need to do the groundwork, those essential things to make your body as strong as possible. And then we can look at the oils and how they can help you. So essential oils, a lot of people worry about whether they're safe during pregnancy, but essential oils, by their very nature, they work with the body. So there are essential oils in the foods we eat, they're used in flavourings, so it's something that our bodies are actually quite used to. So essential oils can come from any part of a plant. So they're basically the aromatic compounds of a plant. So they can come from the roots, they can come from the leaves, they can come from the petals. So roses come from the petals, and peppermint, will come from the leaves. And they can come from the bark, they can come from the sap. So any part of the plant, and it's that part of the plant that's got those aromatic compounds. Now, it can be difficult if you're wanting to sort of check with your midwife or your GP as to whether the oils are suitable for you, because quite often they don't have that necessarily have that expertise. So it's really important to do a bit of research yourselves and find out what oils are good for you. There's a really good book, which at this point I shall, which is the one that I tend to sort of go to. It's called Essential Oils for Pregnancy, Birth and Babies, and it's by Stephanie Fritz, and she's got a really good Facebook page, so you can find her, and there's also sort of another support page. So she's called The Essential Midwife, and that's a really good book to get. It's lots and lots of different ideas in there. So pregnancy is a time of great change, so there's an awful lot of things going on. So we're looking for the essential oils to help support you and help you deal with those physical and psychological changes, because there's a huge amount of psychological changes too. So one of the things with using oils in pregnancy is, if you're going to use them on your skin, is to dilute them heavily. So dilute them more than you would normally do so. So and start off being really, really cautious, and then just sort of see how your skin reacts and how you react, and you can then increase it slightly if you want to. Some oils are photosensitive, so if you go out in the sun, you're more likely to sort of burn or whatever, so that tends to be the citrus oils. So when you're pregnant, you're that bit more sensitive to that as well, so just being really sort of aware of that. So just being a little bit more careful. So I'm just going to sort of quickly run through some ideas of things that you can do and ways that you can use the oils. So the different ways that you can use the oils is that you can use them aromatically. So you can use them in a diffuser, you can put them in your hands, you can smell them, but you can also massage them onto your skin, onto your body as well. So in the first trimester, head discomfort, if you wanted to try and deal with some of that, that can be hormonally related, so some oils that can really help with that. So I use a particular brand of oils called doTERRA. So some of the oils that I'll mention are blends, which are unique to them, and some are single oils. So a blend that they do that is really good is called Deep Blue. I think it smells like a nice version of Deep Heat, and you can use it in a sort of similar way, but it is really, really good for aches and pains, but it's also really good for releasing tension as well. Peppermint, which is my go-to for head tension, head pains, and a blend called Clary Calm, and that's a really good one for helping balance hormones as well. Tiredness, obviously your body is working very hard, so inevitably you will get more tired when you're pregnant, and so it's just really important to be really kind to yourself and look after yourself. So some oils that are really good at that point are a blend called Serenity, so that's got things like lavender and vetiver and things in it. That's a really, really good oil for helping with sleep, so that's, you know, my go-to one for sleep. Magnolia, Clary Calm again, and lavender's a lovely one for just helping. So all of those you could put in the diffuser, or you could use them as part of a massage. For nausea, a really good oil to use for nausea would be cardamom, again in the diffuser, or just some in your hands and just taking a smell and taking that breath. Or even just for nausea, you can just literally open the bottle and smell it from the bottle. That can help. Cardamom, lemon, ginger, and again peppermint. Peppermint comes up quite a lot. There's a bit of a theme here. Peppermint is a very versatile and very useful oil. So in the second trimester, if you're starting to get sort of aches and pains and things, hip discomfort, back discomfort, again, blend that we mentioned before for head discomfort, Deep Blue, can be really useful for that as well. Black pepper, wild orange, and frankincense can all be really helpful. So they can be used diluted. I usually use fractionated coconut oil to dilute oils, and they can be used for massage. Especially at this time of year, seasonal threats, so reactions to pollen and stuff like that can be a bit tricky, and it can be even more uncomfortable if you're pregnant. So there's a blend called Zengest that you can put just over the bridge of your nose that can really help deal with congestion. But for anybody, pregnant or not, there is a really, really good combination, which is lemon, lavender, and peppermint, that you can use. And again, you can make that up. You can dilute that and put it on your skin, or you can put it in the diffuser, and that can be really, really good for dealing with those issues. And helping to clear the nasal passages, we're back to peppermint again, so that can be really good. And there is a blend called Air, so again, putting that either in the diffuser or putting it in your hands and breathing it in, that can be really good. Second trimester, quite often we get heartburn coming in there. And cardamom, Zengest, Roman chamomile, and turmeric can all be quite helpful to help with heartburn. So again, getting that diluted oil and just massaging it into the area that you need. Any teeth problems, you could also use some oils there. You could make yourself a little mouthwash, and there's a really good blend that's called On Guard, and you can do loads of things with On Guard. want to know more information on that one, you're very welcome to ask me. But it's got things like clove in it, which we obviously know is really good for teeth, and wild orange, so it could be really good for helping with teeth. And in fact, doTERRA do a really nice toothpaste, which I love as well, which has got all those things in it, which is an On Guard toothpaste. For in the third trimester, oils that you could use for fluid retention and varicose veins, cypress. Cypress is a really good oil for this, so that can be used as a nice massage there as well. And then you can also use oils to sort of help with sort of stretch marks and just helping your skin sort of adjust to its growing. And frankincense is a wonderful oil for that, as is rose and yarrow pom, which is a new oil that is just coming out in Britain here. So that's yarrow and pomegranate together. They are really good. So in the third trimester, the other thing I was going to talk about is perineal massage, and that seems to be sort of, I was going to say controversial. Some people are very keen on it and other people aren't, and if that is something that you're exploring, then oils like frankincense, lavender and clary sage can be used, but these are all with perineal massage it should only be from 37 weeks, and clary sage is an oil that you should only use from 37 weeks as well. So those ones there. So one of the things that I was going to say in terms of what you can do during your pregnancy to help with the birth, what we do know is that our smell and sense of smell and memory are very interlinked. So we tend to, you get memories are triggered when we smell something familiar. And what we can do is we call it anchoring. You can actually create a really relaxing experience, or use an oil for at a time that you know you're going to be really happy, and use that oil at that point. And then when you come back to that oil, you have that memory of that relaxing experience. So with the oils that we've talked about already, if you've used those during your pregnancy and you, for instance, maybe used them in the bath, because that's lovely as well. So you don't want to put oil straight in the bath, but if you put them into bath salts, you go into the bath salts and you put them in the bath, create that lovely relaxing experience, then use that same oil when you're in labour. It will trigger that memory and hopefully it will help you to relax. So oils that you could use in your birth bag, so packing these ready. So even if you're having a home birth, it's always good to have things packed and ready just in case. It also keeps them all in one place so that you can you've got them all at hand. Again, clary sage, lavender, Roman chamomile, they're all good oils to use for massage and for calming. Balance is a blend that doTERRA does, and it's one of my favourite blends. This is a blend that I recommend to more or less everybody that I work with, whether you're pregnant or not. It's called the Grounding Blend, and it's just a really grounding and calming blend. You can literally just put a couple of drops, take some like 5 deep breaths of the Balance, and it can really bring anxiety down. And obviously at the moment anxiety is quite an issue for everybody, and for those of you that are pregnant, obviously it's even more so with the situation that you're having to deal with. So Balance can be really good for helping with that. I also like putting it together with wild orange, because wild orange is quite an uplifting oil. So Balance and wild orange together can be quite calming and grounding, but at the same time lift your mood. So I when I do the baby massage, that's a blend that I will start off with. That's my present to mums when I'm doing the baby massage in person, that they get a Balance and wild orange to use. So preparing for nausea, we're back to our peppermint again. So peppermint can be really handy for helping that nausea, just taking the lid off that bottle and having a smell. And some blends for massage, to massage on your back to help soothe discomfort there. The deep blue again, which we talked about using before, and black pepper. There's also another one it's called Aroma Touch, which is the massage blend. That can be really, really, really useful as well. Jasmine and clary sage are the two oils that you should not use before 37 weeks because they can have uterine effects. So they can be used in labour, and quite often people will use them just to help things keep going. And they're really good put together with things like neroli, frankincense and ylang ylang. They go really well together. Now, I have a friend who is a midwife who is very, very keen on the oils, and she has put together a blend that she calls the Take a Breather blend. And it has spearmint, Siberian fir, cypress and grapefruit. And it's a really, really lovely blend. It's a really sort of pick you up blend to sort of help motivate you and keep you going and keep you nice and calm. And that's a blend that she really recommends having in your diffuser. So these cold air diffusers is the best way of getting oils into the air in your house, and using that during your pregnancy, and then having that as a blend that you could perhaps use in labour. If you can't take a diffuser in to where you're giving birth, what you can do is you can get a spray bottle and mix the oils with water, and you can give it a shake and just have a spray, and have that in the air. And some oils that sort of help you keep you going, wild orange and peppermint, which is a really good blend for any of us that want to keep us going. Is a wonderful combination. Chia is again another blend that doTERRA does, and Motivate. These are really good, and I've had my Motivate on today to keep me going. There are also just some suggestions for soothing sprays, so to deal with any sort of tears, hemorrhoids, that sort of thing that you can make, and it's quite good if you mix it with witch hazel and aloe vera. So frankincense is a wonderful one to add in with that, and clary calm, Roman chamomile and lavender. And you can actually put these onto pads and put them into the fridge, or into the freezer, and I'm told these are called padsicles, that can be really, really soothing to then, once they're nice and cool, to then to use after that. So as I was saying, lavender we've talked about quite a bit. Over your heart during labour can be really, really calming, so really nice to keep you nice and calm and balanced, like we talked about before. So one of the things that I would recommend is, if you're wanting to use your oils, if you're wanting to use essential oils during labour, is to get them and to play about with them beforehand. And we talked about this anchoring, this creating a nice memory. If you want to do that and you would like to do that with some sort of hand or foot massage, absolutely welcome to contact me, and I can either talk you through doing that, or I can send you links to videos on how to do that. So that is a really lovely way of anchoring the relaxing effects of essential oils. So that's a quick sort of run through the different oils that you can use. And if you want to know any more information about how to get hold of the oils, just message me and ask any questions you would like. So yeah, the book I recommend is The Essential Oils for Pregnancy, Birth and Babies by Stephanie Fritz, the Essential Midwife, and you can find her on Facebook as well. All right, lovely to speak to you this evening, everybody. Take care. Goodbye.